Hi, I'm Bill Farrer. I'm the Program Director at the Trinitas Internal Medicine Residency Program. I'd like to welcome all of you who are viewing this video and tell you how excited I am about our program. Trinitas has grown over the years. We are now a regional medical center with many different services, but we're still a relatively small community-based hospital. Our residents are from all over the world, and they get along fine. They work in teams, not only with each other, but also with the nurses, dietitians, and other healthcare professionals that are part of the medical team. The program is sponsored by Rutgers New Jersey Medical School, which is now part of Rutgers Health, an umbrella group that oversees both Rutgers medical schools. We're very happy about that affiliation and sponsorship. We have faculty from the medical school coming and giving lectures and clinics in certain areas. We have the capacity to have our residents do rotations at University Hospital, and they have other services such as OSCEs and participation in their departmental research days that are very important for our residents. Trinitas is also a teaching center for medical students. Most of our students are from St. George's. We also have students from two osteopathic schools, Touro and NICOM. And so I tell residents that they're always going to have a student with them, no matter what rotation that they are on. Our location is here in Elizabeth, which is the fourth largest city in New Jersey, with a population of about 130,000. Elizabeth is a melting pot. There are people from all over the world here. We are located just across from Lower Manhattan, and it's an interesting place to work. I find that the pathology over the years has been consistently exciting, and we get to build relationships with our patients through clinic, and the residents really do appreciate the responsibility that they get when they work in our program.
Hi, I am Sadanand Palekar. I'm the Director of Primary Care at Trinitas. My role is to help you, assess you, evaluate you, train you in the continuity clinic. In Trinitas, we have our continuity clinic where residents inherit, new incoming residents inherit patients from outgoing residents. And they get a whole panel of their patients on day one. And then they add to those patients as they go along for the 3 years of their residency. It's called continuity clinic because you will be responsible for your panel and you will be their primary doctor. You'll be supervised by preceptors who will take history from you, hear your physical examination, assessment and plans, help you with physical exam or looking at findings if needed, go over the management, assessment and management of patients. They will be ultimately responsible for the patient, but remember, you will be their doctor. Thank you.
My name is Dr. Michael Brescia. I'm the director of the intensive care unit here at Trinitas Regional Medical Center. We are a community hospital that I feel really deals with an inner city patient population. We are composed of approximately 25 beds. During the COVID epidemic, we actually added on another 10 to 12 beds, so we're able to increase our intensive care unit beds if needed. We plan on, right now, we are a level 3 center. However, we have an application in to become a level 2 trauma center.
Welcome to the program. I'm Raja Pulat. I'm I'm the Associate Program Director of the Internal Medicine Residency Program. I'm also Key Clinical Faculty for the Cardiology Fellowship. My role here is varied. I do morning reports a couple of times a month. I do teaching rounds. I end up being part of your faculty for your cardiology elective. I'm also involved heavily in administration. One of the common questions we get asked during the interview season is what kind of scholarly activity and research do we offer? I'm proud to say that we have a pretty robust program for encouraging scholarly activity and research. Approximately 3 years ago, we actually came up with a quality improvement, quality assessment curriculum, which is longitudinal over the 3-year period you will be here in residency. It starts off during your intern year with close association with the hospital person for quality improvement and patient safety. You will be working with her during your ambulatory month. That gives you exposure to how the hospital runs their quality improvement and patient safety program. Also during your intern year, you will be completing 13 modules, part of the Institute for Healthcare Improvement. This is a certification course for quality improvement and patient safety. This will be a requirement for all interns to complete by the end of the first year. During your second and third year, you'll be involved in individual quality improvement and assessment projects. They're usually headed by a third-year resident, and they form team members which include both PGY2s and PGY3s. And usually these projects are resident-driven. It's also monitored by the chief resident, and I will be closely involved in it. We usually start the projects early in the fall of the academic year, and then the projects end by the spring of next year. And these projects are presented both at the Trinitas Research Day and at the New Jersey Medical School's Research Day for Internal Medicine. Some of these projects have been presented at national meetings. An example being 2 years ago, we did a project on the new telemetry guidelines, and that was presented at the American Heart Association meeting. We also encourage other forms of research other than quality improvement and quality assessment. We've had a bunch of our residents present at both national meetings and local meetings of their interesting case abstracts. They've written multiple case reports, case series. We've also had our residents involved in writing research proposals for research studies, which can be done in a feasible manner in the 3 years you're here. And we've had a great deal of success in our residents completing these projects and having their research published, both as abstracts and as a full paper. In terms of the research, one of the expectations is that you will need to know how to write a research proposal. We do have a curriculum for that. We have a statistician come from the Rutgers Medical School who gives around 3 to 4 lectures a year going over basic research protocols. You will also need to complete a CITI program, CITI program, prior to being involved in any form of research which involves the IRB. So, of note, really, during this COVID pandemic, which was very trying, but our residents were very resourceful. They created a large database of patients, of COVID patients, approximately 500 plus, and we've had multiple papers, both abstracts and full papers, being presented and in the process of being published. Welcome to the program. Thank you.
Hey, how's it going? My name is Dr. Narbat. I'm one of the service hospitalists. I've been here for about the past 6 months as a service hospitalist, and before that I was actually one of the residents. I graduated in 2019. just want to tell you a few things about my experience. One of the things that I really loved about being a resident here was the camaraderie. Nobody really has the mentality of being a gunner or trying to outdo everybody. It's really like a very team-oriented kind of place, which is by far was my favorite thing about it. And ultimately, it's what made me come back as a hospitalist. And the same thing goes with all of the faculty and the consultants and all of that, which again is really, I think, the best thing about working here. And I think that in the end, you know, if you're somewhere for 3 years, that really is going to be the thing that you remember over time. So hope to see you here next year, and best of luck to everybody.
Guys, I'm John. I'm one of the current residents here at Trinitas. Right now I'm a third year. I'm associate chief, but prior to this I was actually a student, and luckily I've been able to transition from student to resident in this program. It was initially very anxious, as I imagine you guys are feeling right now, but one of the things I quickly realized here is you got a lot of support from the top to the bottom, whether it's your program director, associate program director, your residents, even the ancillary staff. So it was one of the better experiences and surprises that I didn't expect. Of course, as with all residencies, it does come with its fair deal of studying, hard work, but I'm confident that if you made it this far, then you have nothing to worry about.
Hello, my name is Anurag. I'm one of the second year residents here at Trinitas, Rutgers, New Jersey Medical School. I just wanted to briefly comment on my experience here at Trinitas. I think one of the big positives of the program is that I get a lot of autonomy on the floors and managing patients in the ICU as well. On top of that, I have direct contact with all the consulting physicians, specialists that you may not see in other larger programs, which is a big benefit to us in terms of education and correct management of patients, both textbook and reality. My experience through COVID was bizarre, as for everyone in New York and New Jersey, but I definitely had a lot of help from other primary care physicians who stepped up and took charge for a lot of the patients. I also appreciate a lot of the closeness the residents have together in this program. I think as a small group, we get to know each other a lot and considered family for all of us. And so to all the applicants, good luck, and I'm hoping to see you all here.
Hi, I'm Masa, and I'm one of the first year internal medicine resident. To me, the most important factors are learning medicine from a diverse patient population and working in a supportive environment. I'm a graduate of Shiraz University in Iran. When I was applying for residency, I knew that I can learn medicine only through a wide range of patient population. There is no shortage of encouragement and guidance along the way, and I'm really happy to work and live in such a friendly environment. Good luck to you all.
Hi, my name is Dr. Michelle Chalenkrel. I'm the Division Chief of Medical Oncology and one of the teaching attendings here at Trinitas Medical Center. I've had the experience of working with the residents for years on bedside teaching rounds in the hospital, as well as a consultant in hematology and oncology. We've had various residents come through our medical clinic and cancer center and round on us during elective, and we've also been a part of tumor boards as well as multiple resident meetings. This year we've actually had a new issue that we had to deal with as the whole world was dealing with the new pandemic, COVID-19. We were one of the first hard-hit spots in the Northeast, and due to that had very few therapeutic options for our patients. Elizabeth is in a very ethnically diverse area with a large amount of Hispanic as well as African American population, and for that we did see a great deal of COVID-19 patients. As this was the case, Trinitas sprung to the occasion and not only found PPE for all of our healthcare professionals and for our residents, but we also looked for therapeutics to care for our patients. We were lucky enough to be involved in the Mayo Clinic national trial to give COVID-19 plasma to our patients, as well as the internationally run Gilead trials that use remdesivir for the emergency access use authorization. Including this, we were also able to obtain interleukin-6 inhibitor, tocilizumab, as an investigational drug and administer this to our severe COVID-19 patient population with pretty good results for our patients with cytokine release storm. We also were able to be part of the VD Labs mesenchymal and exosome stem cell infusion that we had given to various patients with severe COVID-19. With all of this, we felt very confident having multiple therapeutic options for our patients in clinical trials, and hopefully you'll hear data about all of these options quite soon. And if we are ever dealt with this issue ever again, I think we will be in a good position. We're more secure with our therapeutic options, have PPE for our staff, and we're looking out for our residents. Good luck this interview season. Hope to see you soon.